Asthma is one of the most common diseases known to man. The word asthma comes from the Greek word that means panting, which makes a lot of sense as it does affect the lungs, resulting into difficulty breathing. For most people affected by asthma, it is common for them to go through asthma attacks that are usually caused by outside forces.
Here are a few factors that contribute to asthma. Allergens such as dust mites, pollen, cockroaches, mold, and rodents. Irritants such as smoke, air pollution, or wood fires. Respiratory illnesses such as colds, flus, or a sore throat. Exercising. The weather, such as dry or cold wind, or sudden changes in the weather. Feeling and expressing strong emotions such as stress, excitement, fear, laughter, and crying. Hormonal periods such as menstrual cycle. Some signs that indicate that you may have asthma are frequently coughing at night or during exercising, difficulty breathing such as wheezing, shortness of breath at night, chest tightness, anxiety, fast heart rate, or throat irritation.
For those with allergies, you can get an allergy shot, which gradually reduces your immune system reaction to specific allergens, omalizumab, which is given as an injection every 2 to 4 weeks, specifically for people who have allergies and severe asthma, and acts by altering the immune system. Bronchial thermoplasty, which is not widely available nor right for everyone and heats the inside of the airways and lungs with an electrode, which reduces the smooth muscle inside the airways and limits the ability of the airways to tighten, making breathing easier and possibly reducing asthma attacks. And then there is the Asthma Action Plan, which creates an asthma plan with your doctor that outlines when to take certain medications or when to increase or decrease your dosage.
There are different types of triggers for asthma. This would include tobacco smoke, smoke from grass or wood, air pollution, certain foods and food additives such as sulfites, parabens, respiratory infections, strong emotional states, and even certain medicine. And if you smoke, stop immediately because it's a common sense to do so. And not to mention, it causes secondhand smoke and you can get asthma too.
For pulmonary function tests, the forced expiratory volume, or FEV test, is used clinically to measure the resistance to flow in airways. With the case of asthma, a low FEV means a high resistance to flow. During an attack, the resistance to flow increases, so FEV decreases. Blood tests are measured to see if respiratory acidosis has occurred. This is because of resistance to airflow, which means carbon dioxide production is greater than the amount being eliminated. The sputum exam is tenacious, rubbery, and whitish. For a chest x-ray, findings from this may vary tremendously from a hyperinflated lung to normal. And allergic testing is just basically skin testing. Here are different treatments available for asthma. For quick relief, there are short-acting beta-agonists, which are inhaled medications, ipratropium, which is similar to a bronchodilator, a drug that widens the bronchi, and oral and intravenous corticosteroids, which relieve airway inflammation by severe asthma. For long term, there are inhaled corticosteroids, which are anti-inflammatory drugs, leukotriene modifiers, which are oral medications, long-acting beta-agonists, which are inhaled medications, theophylline, which is a daily pill that helps keep the airways open, much like a bronchodilator, and even a combination of inhalers can work.
Not only do specific foods cause allergic reactions, but it can also cause asthma attacks due to the specific preservatives such as sulfites and parabens. In order to avoid this, avoid processed foods and such. Asthma can be caused from genetics and the environment. Genetics of asthma is complicated and it can only be explained based on an individual's phenotype. Income can contribute to the problem of asthma through diet, living conditions, and access to health care, as well as education. Living conditions such as dampness, crowding, poor housing conditions, and the use of certain fuels for heating can contribute to asthma. Having education means you have a chance of learning about the health care that you can apply for to learn more about asthma.
Asthma is very expensive to treat due to various types of medications and treatments. It is also due to location of where you live. If you live in a poor environment, you're most likely going to develop and have asthma.
One variation of common behavior of those who know someone with asthma is that they will most likely have to be more conscientious around them, meaning that they will have to be more careful with what perfume they will be wearing and become wary of what they can do and what they cannot do, and etc. and such. Asthma can be caused from genetics and the environment. Genetics of asthma is complicated and it can only be explained based on an individual's phenotype.
Hello.
Phenotype. Phenotype.